Hi everybody, welcome back to my channel. Today we have a special guest. Ta-da! Ta-da! This is my older sister Millie, Mildred. I'm Jennifer, but we're gonna go by Jan and Millie. Okay, so today from the title you can tell we're gonna be talking about my sister's cancer journey. We asked questions on Instagram if people wanted to know about endometriosis, infertility, ovarian cancer, and what is the last one? Hysterectomy, because she's experienced everything. She's very experienced in this category. A lot of them want to know, how did you find out you had endometriosis?
Back in 2018, I went to a new OBGYN, and again, I'm going to say this. Don't ever let any doctor dismiss you. So advocate for your own body.
Yes.
I went to see a new OBGYN because the one that I had
Just didn't feel like she was catering to you.
Right. She wasn't fulfilling my needs.
There you go. Like your annual checkup wasn't like a real annual checkup?
So the annual checkup was just breast exam, pelvic exam, pap smear, and then I addressed to her so many times that I was having pain with my periods, heavy flows, and irregular periods. Basically, I would go like months without a period, and then all of a sudden 1 month with period. I saw a new OBGYN in 2018. I went to my first appointment and he addressed everything. He did my exam, and then he was just like, okay, tell me about your periods. And I said, it's irregular. I would have it like for 7 days. It would be heavy. And he asked me, are your periods painful? And I said, yes. Like I would have a lot of cramps, and I would have back pain. I would be fatigued, and my left side during the time of the month would be like super painful compared to the right. So he did my exam, and then he's like, we're gonna do an ultrasound. And I said, what?
You're the professional.
I said, okay, like I'm liking this doctor already because he's addressing my needs, and he's not pushing birth control pills down my throat. He did the ultrasound and he's walking me through it. He's like, you know, Millie, like your uterus is like huge. Like it shouldn't be huge because you're not pregnant. You don't
like
have
enlarged.
Yes. And you don't have your period right now, so there's some they call it lining, thick lining of the uterus. And then he said, and there's definitely something on the left side, like I can see something, but not like I can't really tell. I don't know if it's a cyst or if it's a tumor. He referred me to another specialist who did better scans, and it's called a sonohistogram. Basically, she did the test in her office, and she was just like, yeah, you definitely have a huge cyst on your left ovary. With PCOS, I was diagnosed, so polycystic ovary syndrome, I was diagnosed back when I was a young adult. Called the OBGYN at that time. She did an ultrasound, and she's like, yeah, you definitely have PCOS, and the imaging. So I was already, like by this time in 2018, I was already diagnosed with PCOS.
But only in 2018 is when it started to get more painful.
Right.
More irregular.
Right.
But when you were a young adult, as like 18 to
31.
Okay, but since then you've also had pregnancies, miscarriages, and that's a touchy subject for us in general. Not just us, but like for women in general to have a miscarriage. So we're not going to get into that, but from 18 to 31 she's had PCOS, and at 31 she was diagnosed with endometriosis. I think it's important because you are a nurse. You liked how your doctor made the effort to kind of address your concerns, whereas you know some doctors, they're like, oh, it's fine, you're fine, you know,
oh, we're gonna treat your irregular periods and your pain with hormonal therapy, so birth control pills. So all throughout my life I was going through like different birth control pills. It worked, it didn't work. I had to go through a lot of like they call it DNC, where they do a biopsy of your uterine lining to make sure you don't have uterine cancer, etc., etc. I've had like 3 surgeries.
So do you feel like on top of your multiple miscarriages, the DNCs, you think that kind of like led to all of the endometriosis?
Mm-mm.
No?
I don't think so.
No. And one factor that a lot of doctors ask about PCOS is, do you have like really bad hormonal acne? Do you have male hair features in areas where you shouldn't have? So like chin, upper chest, I believe, and like your lip, right?
Yes.
So I mean, normal peach fuzz is normal, but there is a different type of hair thickness. It's basically you have a higher testosterone level of hormones in you. So on top of PCOS, endometriosis, you went through scanning, and then
Specialist who did the scan sent me back to my doctor, my regular OBGYN, and said that I would probably need surgery. It was a surgery to take out the left ovarian cyst. Actually referred me to the OBGYN oncologist back then.
oncologist means
Oncologist means he takes care of anything abnormalities that could turn into cancer, basically.
there you go.
So I was referred to Dr. Terada. He did the surgery back in 2018. It was an outpatient surgery at that time, and unfortunately they couldn't take out the cyst at that time. Because of the way the procedure was set up, they were using the robotic machine to go inside to do the surgery. He didn't cut me open and take it out himself. He basically used the I think it's called a Da Vinci machine, and they poked 3 holes in my tummy, and then they
went through it.
Yes. So because of the way the procedure was set up, it was an outpatient procedure. I thinking anesthesiology wasn't like enough to put me under to cut me open and for him to take out at that time. And then of course my weight played a factor into that. Back then I was like 327 pounds. Couldn't fully take out the cyst. He did biopsy it though, and at that time that's when the diagnosis came back: endometriosis.
And what is endometriosis?
Endometriosis is basically tissue that grows outside of the uterus, and what it does is it can stick to your colon, it can stick to your intestines. It's a mess. Some women who have it bad, it can grow all the way up to their diaphragm. Going with the flow, going with what the OBGYN doctor and the oncologist recommended. So at that time, after he told me that it wasn't cancer and it was just endometriosis, he sent me back to my OBGYN, and at that time I needed to lose weight to perform possible future surgery, just in case they have to open me up and take out the cyst. And then at that time he recommended again hormonal therapy called Depolupron to shrink the cyst. So Depolupron is like I think it's like high testosterone therapy, and what happens is I think it's high because it puts you in like a temporary,
what is that word? Menopause. Yes.
It puts you in a temporary menopause, and so like it holds back the estrogen. I was going through that for 6 months. I had to do 1 shot every 6 months, and then at that time I had to lose more weight.
But you lost a lot of weight at that time.
I did.
So you went from 326 to what was your lowest?
268.
That was.
I went down to 268. I did the hormonal therapy, and when they did the ultrasound in 2019,
you were cleared.
I was cleared. There was no cyst. The cyst had shrunk, or it was non-existent. The OBGYN oncologist said, Dr. Terada said, at this point you don't need to do surgery, but we'll follow you.
Monitor
you every 6 months or every 3 months, can't remember. But the pandemic happened.
The panorama happened.
Yeah, the pinakbet happened.
The panisal happened.
Yes. And I was supposed to do an ultrasound in March. Or actually, I did do an ultrasound in March, and I was still cleared. The doctor who did my ultrasound said, there is a little cyst in there, but nothing to worry about. And we'll see you back in 6 months.
6 months happened.
I was supposed to do a ultrasound in September,
but because of COVID, a lot of outpatient appointments were pushed back.
Yes.
And even for me, when I had surgery, it was pushed back.
Yes.
So it's like you couldn't even get an appointment anywhere. That's how hard it was during a pandemic. Of course, we're not going out. We're working. We're coming home.
Yes.
So half days because of COVID. So she's home. She's eating. But then your period started to give you a different.
September comes rolling around, and I start feeling this pain in my left side, left lower area, and my period starts. It's like 7 days, but it's heavy. But then I would like feel bloated. I would feel like every time I eat, I would feel full fast. And then
to the point to like, I know you were saying at one point like your clots, the blood clots were like humongous.
TMI, yes.
And I mean, this is not like trying to be, we're not trying to sugarcoat things, but how big do you think your clots were? Like,
Yeah.
like about this size. This is my camera cap.
Yeah.
This is big. This is large.
And I had to wear those overnight pads.
Not Pampers. You could if you wanted.
Overnight pads. It's the purple. Oh my god, it's the purple bag, and I would go through those like every 3-4 hours.
Yeah, that's how heavy her periods were.
It was terrible. And mind you, I have to wear white to work.
Yeah, so their bottoms, their scrub bottoms at work is white. So of course, very prone to leakage. She would have to bring like extra underwear and scrubs to work. What made it so to the point where they're like, we need to do surgery now?
My OBGYN was like, hey Millie, I know it's the pandemic, but you are due for your appointment and we're taking patients now and whatnot. And he was kind enough to say, how are you doing? So I told him, you know, yes, I am ready to see you because I've been having pain in my left lower side and whatnot. And so he did. So I went in to see him, and then he was like, okay, let's schedule your ultrasound. By this time it was already October. And then we did the ultrasound, and the doctor there was like, yeah, the doctor who did my ultrasound says, yeah, you probably need surgery to take this out, because from March to October it had grown to like this much. I don't know, it was kind of big. Maybe okay, maybe like that, maybe a little bit bigger than this. Yeah,
or this one.
This one.
There we go.
Yeah,
We need visuals for everybody. So this was this big on your ovary.
Yeah.
But your ovary is how big?
like,
Your ovary is like half the size of this, no?
yes,
Because your ovaries are like this. It's like
right.
and then your uterus is right here, right? So it's
Right.
like this. So post a picture. So the size of a cyst of this size on an ovary. So of course I think that's alarming for the doctors.
And then she said that my uterus lining looked abnormal as well. So I was just like, okay.
To the endometriosis and the cyst.
Yes.
Double whammy, basically.
Yes. And so I was just like, okay, we need to get back into like the appointments and whatnot. So immediately my doctor saw the results and he was like, hey, we need to refer you back to Dr. Terada. So I went in to see Dr. Terada. He did my exam. He brought me into his office and he said, Millie, I'm sorry, but I think you need to get surgery done to take out the cyst. And I said, okay. And then I was like, let's do it. And he's like, and then he asked me the question, are you planning to have kids? And I said, well, I would want at least one. I want to try. I mean, we're trying. And he's like, well, the only reason why I asked is because the lining in your uterus is abnormal and I don't want that to turn into cancer. And I said, okay. He's like, so at this time, I think I'll recommend hysterectomy for you. And I was just speechless at that time. I was just like, okay, like I really want to have kids, but then at the same time, I don't want to have like
Complications.
I don't want cancer in my uterus.
You don't want to lose your baby or lose yourself.
Right. He's just like, you go home, talk to your husband about it, and then let me know what you want to do and we'll schedule your surgery. So I said, okay. So after that was done, I got in the car and my husband's like, so how did it go? Because he couldn't come with me because of COVID.
Because of the hullabaloo.
Yeah. So a lot of these appointments had to go in by myself, and I still have to go in by myself because of COVID. I just started crying, and I was like, like he recommended a hysterectomy, and because there's, abnormal lining, and he was just like, let's do it. And I said, let's do it. I want to give you kids. Like, I want to make you a dad. I want to be a mom. And he was like, I'd rather have you here. And at this point, like, my doctor didn't even think about cancer because he's seen this so many times where just another ordinary cyst, but because there's abnormal tissue in the lining, we recommend hysterectomy. But he wasn't thinking at all that it was cancer. He was just thinking in advance,
if
just
it
in
does
case.
turn to cancer.
Right. Praying to God, I was just like, what do I do? My husband, Vernon, was just reassuring me that he's still gonna love me regardless if I give him kids or not. So I was just like, okay, we're set dead on this.
We're gonna do it.
Let's do this. It was kind of hard. It was kind of difficult to reach this out to like my sister. So like I had to keep it to myself for like a couple weeks. Deal with my emotions. Like there are times when I would like cry in my room, and so I got all of that out, and I said, okay, God, let's do this. I went back to see the doctor, did my pre-op, scheduled me for after Thanksgiving because I wanted to spend Thanksgiving without pain. On December 3rd, I ended up having a hysterectomy, but they left my right ovary in
to help with your
produce hormones. Because if I don't have that, then I'm in menopause.
Menopause.
Through a hysterectomy, they're supposed to take out everything: cervix, ovaries, fallopian tubes, and your uterus.
What did they remove from you?
So they removed my left ovary, my 2 fallopian tubes. I'm left with my right ovary and my cervix. And I found out that they don't usually take cervixes out anymore because that right there, it helps to hold. I learned this from my OBGYN. He said there's ligaments that hold the cervix, and then those ligaments will help to prevent vaginal prolapse.
Prolapse as in like your vagina falls out?
Yes.
So not your upper mound, not the upper mound of your vagina, but your insides of your vagina falls out. We're learning so much in health class today.
So I did the surgery, mind you, during a puto. Go in by yourself. You're in the waiting room, in the room, pre-surgery room by yourself. You don't have anybody there to talk to except for the nurses. And thank God, Queens Medical Center, thank you so much. You guys were awesome. The nurses there was awesome. And they kept me company before and after and during. Usually when I go through surgeries, Vernon is there to hold my hand and to make sure everything is okay. He wasn't there. And he was trying to keep busy.
Oh yeah, sis, he cleaned the whole house.
Stayed in the hospital for 9 and a day.
Yeah.
And then I finished my recovery at home for 6 weeks. So I went home on December 5th. On December 7th is when I got the call about my cancer diagnosis. I got a call from my oncologist, and he was just like, hey Millie, how are you doing? And I said, I'm doing okay. Pain, is manageable, etc., etc. Able to talk right now? And I said, yeah, I'm able to talk. And he's like, okay, well, I wasn't expecting this, but the pathology report of your ovarian cyst showed cancer. And I was like, what? And he's like, yeah, it showed cancer. I'm so sorry. And I said, is it bad? He's like, right now it looks stage 1, but they're still looking at it. So it's stage 1. I'm gonna recommend chemotherapy for you. The way they did the surgery is they had to stick a needle in first before they could take out the ovary. They had to stick a needle in, and they had to take out the liquid from there. And at that time he didn't quite see, like, he couldn't tell the color or it didn't look like it was cancer. So he was just like, because that procedure in itself, where they're taking out the liquid, they don't know if that liquid spilled out. The cells were, leaked out into anywhere else in my body. So he said, we want to do the chemotherapy to get rid of any hidden cancer cells. And he's like, we're gonna start you soon, but I want to make sure that, you know, you and your family are ready. There's gonna be a lot of changes to come, and I want to see you before then. So I was like, okay. And I told him, okay, thank you, doc. Thank you so much for letting me know, and that I will call soon to schedule an appointment. And he said, you don't have to start chemotherapy now. You can start chemotherapy next month, which was January 8th.
My birthday.
Hung up the phone, and my husband's like, well, and I was like, it's bad. And he's just like, what? I go, it's really bad. And he's just like, what do you mean? And at that time I just started, you remember? Yeah, I think I just started bawling, and I was like, the pathology report showed cancer. And he was just like, what? And I was like, yeah, like, what am I gonna do? You know,
we were all like, what are we gonna do? You know.
So I was like, so what are we gonna do? You know, I have to like, and Verna's have to work extra hours. This one was already like, I can look for another job. And I was just like, no, you know, like, we could start a GoFundMe. I was like, no, I'm not that kind of person who's taking money from
other people.
Yeah. Well, if I can, I'm just so emotionally tired. I took a nap. I think I took a nap after I got that call.
I think we just stayed. We didn't talk about it.
Yeah.
We just like you kept to yourself. Me and Kaz kept to ourselves.
Yeah.
And when I told Kaz, I cried. We didn't even tell our mom for like a good 2 weeks.
We didn't even tell
we
mom.
Didn't tell mom.
Like,
we didn't tell a lot of people.
I was just like, because like, it's so stupid because I would be in my room and I would practice telling my mom. And I would start bawling like, Mom,
I have kids.
Yeah. And I was just like, oh my god, this is so stupid. And so I was just like, you know what, we just need to tell Mom. But I think you told her.
How did I tell her?
I don't know.
I don't remember, but it was just, you know, our mom, she's very melodramatic. Sometimes she's like, it's fine, it's okay. And then there's days where she's like crying, like our grandma's funeral. The whole time up to grandma's funeral, no crying, it's okay, grandma's in heaven now. The day of my grandma's funeral, bawling, like didn't want to let her go down. I was just like, we were worried she was gonna jump in to the grave with my grandma. So my mom, when we told her, I guess she kind of like was worried, but she was like, you know, my mom's very spiritual. She's very spiritual, so she's just gonna take it day by day. And she's been coming around more often. Like, we don't live with her mom. Mm-hmm. We live together away from mom. And, you know, she's living her life. She don't got kids with her now.
Yeah.
But she's been coming over more often, seeing her favorite child. This is our, like, family joke. My mom loves my sister more than me. But, you know, when we found out about the cancer, I think it was really hard to hear about her not being able to have kids. Mm-hmm. And then
the icing on the cake
was the cancer. So I think you kind of explained what everybody was asking about. So how did you find out? What advice? Okay, so this is a good one. Like, your yearly checkups, I think, is the main one that we want to say. Like, it's so cliche to be like, no, I don't want to go to the doctor. I don't want to, like,
I'm good. I'm
good.
Healthy.
It's not that bad.
I don't have a cold.
My cramps don't hurt. I used to be that person until, like, I have a history of carpal tunnel. Until my hand, like, when I'm holding my Yeti and I drop it because my hand can't grip anything, that's when I'm like, fuck, I need to go and see a doctor because I waited too long. I didn't get to prevent it. Now I have to treat it. So I think that's one thing that we agree on is see your doctor. Mm-hmm. Whatever you gotta do, make an appointment. Mm-hmm. Tell them however you feel. Like, when girls are like, I don't want to go see the doctor because he's gonna put like that alligator clamp in my vagina, then you know what?
It is what it
is.
It's only for a few seconds, guys. Like, these tests is only a few seconds. It's not like 2 hours. Yeah. It's not 3 hours. Like, and just a few seconds can save your life.
Period.
Like,
period.
You know? And don't ever let any doctor dismiss you.
Period.
Like, you have to advocate for yourself. I'm lucky because I have doctors who's fighting for me, you know, who knows, like, okay, this is the diagnosis, let's do this, da 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 da. From my primary care physician to my OBGYN oncologist, like, they're all on the same page. Just make sure that all of your doctors are all on the same page.
And you know, whatever the release of information, share it. Tell them to share it with all your other doctors. Because in order, like, in some cases, like for Quest, because I have Quest, I need my primary care to give my physical therapist information about me, and my physical therapist needs to give it back to my doctor. So it's like, it's a care team, basically.
Yes. But I want to say there's no test for ovarian cancer.
Yeah.
There is no test for that. There's tests for cervical cancer. That's the pap smear. Pap smears don't detect ovarian cancer.
Pap smears.
Pap smears. A lot of the symptoms is pain in your abdomen area, left or right, because you know you have two of them. Bloating, not even like during the time of the month. It could just be like all month.
You just feel fat,
you know, and you feel fuller. Like when you eat, you're full quickly. And then of course abnormal periods, pain with periods, back pain, anything, guys, anything. Like if you're having that, then just bring it up to your doctor, and don't even, like, if they continue to talk about birth control pills, just say, you know what, can we just do an ultrasound, like a vaginal ultrasound, just to make sure everything's okay. Better safe than sorry.
Right. Because do you think that had your previous OBGYN gave you the time of day, you think they could have caught it earlier?
Yes, I would think so. But she just kept saying, you know, let's give you birth control pills. I need to see somebody better.
Who cares? One thing that we talk about often is how it affects me as her sister. Like, genetically we are the same, but not really. And I have hair. I'm just joking. Wow. I'm just joking. You have cancer?
I do?
You have cancer?
No,
I didn't know. I wouldn't have told.
Really?
But she did genetic testing.
I did.
And one thing that I was worried about, that I was like mentally like, oh fuck, like I'm gonna have issues too, is, you know, if she had the cancer gene, then most likely 50% I would have it. But you don't. I don't. Which is good.
Right.
And it's not like having kids is not in our like family, because all our aunties and my mom, like, they've had kids. All of our cousins have kids, so it's something that we personally have a hard time talking about, because you're 36, I'm 26, and people ask us, when are you gonna have kids? And it's like, it's not easy, you know. And I know people, and you've known people who went through like IVF, who've done hormones, who, you know, you have to have sex on the hour, every hour, like 3 days a week. And I'm just like, that's exhausting, you know? Like, sex doesn't become fun anymore, I guess, you know? And it just, sometimes, like, people say, like, my child wasn't made out of love because of, like, that. But we're not knocking on IVF pregnancies, because if you can afford it, by all means. If you can do the other treatments, by all means. It's just, not a lot of us have that funding, or not a lot of us have the willpower to do that, to give yourself a shot every so many days, and then having to do testing. And then I know people who like freeze eggs and freeze sperm. So, and also for girls, like, don't ever think that just because you have to go through this, that you're less than a woman than the next person, than the next girl, because there are women out there who don't want kids, and then there are women who really strongly do want kids. But
that was me. I really wanted to have kids.
You have me.
I'm still with this one.
No, but you have dogs, and you have your friends' kids who you can love and take care of. And I think it's also important that you don't bring yourself down, because my sister would be like, I'm fine. I'm gonna go to work. I have cancer. I'm bald. I'm fine. You know, like, me, I was more worried of her losing her hair.
Yeah.
And the only reason why I was worried of her losing her is because I don't want people to make fun of her. And I don't want people to look at her like, oh, something's wrong with her. Because, you know, I mean, I'm glad we haven't had that yet, because I will fight somebody. But it's just, you know, people can be ruthless, can be heartless. Like even you said, like people you had falling outs with in the past only came around once they known that you had cancer. And that's shady. Like, just stay away.
I would say stay strong. Take it one day at a time. Don't stress. Because when you stress, it lessens the effectiveness of getting pregnant. Just hang in there. I know it's hard. I know it's difficult. I know people are wanting you to have kids and say, you know, when are you guys going to have kids? Don't rush it. You know, all in God's timing. All in God's timing, guys. And if God's willing you to have kids, it's going to happen. Just tell yourself it's going to happen. And don't, I know it's hard to like feel negative about it sometimes, but just turn that negative into positive and always smile and always just, I say just take it one day at a time. You know, like for infertility people, for females with infertility, sisters with infertility, take it one day at a time. Same as sisters who are going through ovarian cancer stuff, cervical cancer stuff, hysterectomies, abnormal periods. Take it one day at a time. Yep. Make sure you see your doctor. If you feel like your doctor is not fulfilling your needs,
find a new doctor.
Yes, find a new doctor.
I think to add on to the advice is, instead of dwelling on it, find something else that will spark joy.
Yes.
Marie Kondo or whatever. Like pick up a new hobby, see old friends, hang out with friends. I feel like if you take your mind off of it, it doesn't feel like it anymore. Like you, in the beginning of chemo treatments, like yes, it was really draining. Like we would always be like, oh, are you okay? Do you need anything? Now we don't care about her. No, she does her own thing. You know, she does her own thing. She doesn't like to feel babied. Like you still need your independence.
Yes.
And I think that's the most important when someone who's dealing with some type of cancer. Like we try to tell her, like, girl, you cannot be eating that, but I'd rather her be eating and have an appetite than her not having an appetite. You still work too.
I know. Yes.
You know, there's some people who don't work, who couldn't work when their cancer, and your cancer is early stage 2, just surpassed stage 1, early stage 2 ovarian cancer. So with all of it, PCOS, endometriosis, hysterectomy, ovarian cancer, you are now on your last treatment for chemotherapy. Yep. What day is it?
April 23rd.
April 23rd is her last chemo treatment, and
I had my OBGYN appointment this past yesterday.
How did that go?
And that went well. I was so happy to see my doctor because I haven't seen him since he referred me to the OBGYN oncologist. Dr. Greg, I love you. He saved my life, guys. And he did my exam, and he was just very happy because it didn't feel abnormal. He said everything. I'm hoping and praying that my diagnosis will be cleared and that I am considered cancer-free, cancer cell-free. And they usually follow you, for any cancer patients, they'll follow you for I think a good 6 years. And then, yeah, just to make sure there's no reoccurrence. I want to say, if you're going through infertility, you're gonna go through hysterectomies, and you have all this stuff going on, build yourself a support team.
Yes.
Gather your closest friends, gather your family, and tell them. Because for me, in the beginning, I only told close friends
and family.
Until
I forced her to like share her story.
Yeah.
Because I don't, like, for me, I speak because I want people to learn, or I know someone out there is experiencing what I'm experiencing. They're gonna resonate with what I say. Maybe like 3/4 of my followers don't listen to my Dear Fat Girls, but 1/4 of them do. You know, and like you said, 1/4 or like a little population or amount of whoever follows you will like you know, these girls have questions about endometriosis and PCOS and all that kind of stuff. Like, not a lot of people like sent flooded in questions, but people asked and we answered, right?
Yeah.
And
it's better to reach out to a few, even if many won't listen. But
Yeah.
a few will always. It's good enough for me.
Yeah.
You know, if it can save a life
and impact someone.
Yeah.
That's all that matters to us.
Yes. Thank you guys for sticking with me through this whole journey. Like, I don't know.
You've made a lot of friends.
I have.
A lot of friends, not within just like her friends, but like a lot of my followers, like send their love and prayers and always send encouraging things. Like, I let her watch and read the comments and the whole support system. Like, it's not just she needs support, it's like we as family need support.
Yes.
Like, I talk to my close friends and I tell them how I feel, and I'm pretty sure my brother-in-law talks to whoever he needs to talk to, just because it's not easy seeing the person you love or seeing someone you love and care about go through something that you didn't ask for. Cancer.
I didn't.
You didn't ask for cancer, so it's
trying to prevent cancer.
Yeah, we were trying to prevent it, but in the end,
it happened.
God only chooses his strongest people to endure certain things. That's how I see it. So you're lucky. You get first entrance into gates of heaven later on in life. But thank you guys so much for watching this video. If you guys want to see other sister videos, please put it in the comments below. Again, this is my sister Millie. She is surviving ovarian cancer stage 2. We are going on her last chemo treatment in April this month. April 23rd. It's her last chemo treatment, and she needs to ring the bell. We will post more photos and stuff on her Instagram and on my Instagram. Lastly, I just want to say thank you to Raven. We are wearing her merch. I bought the sky blue
I love it.
the hoodie set for both me and my sister to match.
It's
so
a hoodie?
not hoodie. What is this called? Jacket? No.
Sweater.
Sweater?
Sweater.
It feels like whatever. Okay, I bought for us to be matching and in the blue color because ovarian cancer's color is teal. This is the closest to teal. So thank you, Raven, for these amazing shirts because they feel nice. They're cozy.
They're so soft.
And they're soft.
And it's not itchy.
Yeah, I think she did this herself. You know.
What do you mean
She tie-dyed it herself.
No way.
Yeah, I think so. It's not the same this one. Look.
Yeah.
So thank you, Raven. Thank you for everybody who sent in messages. Again, if you have more video requests, please post them down below. Anyway,
if you guys have any other questions, don't hesitate to ask. You can DM me and ask me as well. I don't bite. And then thank you everyone for donations. I didn't really get to personally thank my sister's friends for purchasing shirts and for donating separately as well. You guys are awesome, and
that's the last thing we wanted to do. We were like, we're all gonna get extra jobs. We don't want to ask other people for money, but
it's not that because we're proud or we're like whatever, but it's because that money can go to another person who can benefit from it,
who need food on their table, who have kids to feed.
Thank you guys, because it's gonna go to my growing medical bills.
One chemo treatment alone is almost $400 with insurance.
Yeah.
Ooh, yeah, but I will post the Stay Beautiful shirts on my website soon, and they will be able for purchase. And then yeah, other than that, I hope you guys enjoyed this video. Don't forget to give it a thumbs up, comment, rate, and subscribe, and always stay beautiful.
Stay beautiful. Bye guys.